Hey guys, Luna popping in. Thank you so much for visiting my page or my channel. Wherever we are connecting, I appreciate you for being here. Make sure you like, follow, and subscribe so that we may remain connected. Today I had two doctor's appointments at one facility, the Core Institute, where I saw the doctor, the orthopedic surgeon regarding my shoulder and pain management. But before I get started about that, I want to tell you guys about this crazy paperwork, or at least one of the questions in your past history. They asked if you were a victim of abuse, any kind of abuse, sexual, physical, as a child. And I told I was not going to answer that question. Well, you had to give me a yes or a no. I said, you can pick whatever you want because I refuse to answer that question. Almost like I'm not comparing it, but they give you the option to answer about your preferred gender or how you identify, and you could choose not to answer about your race. You can choose not to answer, but about abuse as a child, they want you to answer. I don't think so. So you put whatever you want to put in there and rock with that because I refuse to answer that question. And I don't know, uh, I just don't understand the purpose. What is the purpose of me answering that question in order to talk about my MRI results for a torn rotator cuff? Have you guys seen that question? Anyway, I took a picture of the form. I'll post it after, along with this video, if possible. Depending on what platform you're watching this, I may not be able to attach the form. But anyway, so the orthopedic surgeon for my shoulder verifies that I have a torn rotator cuff in my left arm, which I've known, and he says there's really nothing that can be done outside of surgery to correct it. Physical therapy, according to him, will maybe give me a better range of motion, just but it's going to be short lived unless I continuously go back and forth for an undetermined amount of time for physical therapy, which just isn't going to happen for a couple of reasons. One, mainly because I don't have a car. And another one is they can start to get pricey. All of insurances don't cover physical therapy. One of my physical therapy copays was $60 each at one time. So that's just not going to happen at this time. And I don't think it's going to happen at all, especially since she told me it's really nothing that can be done. So he printed me off some exercises that I can do here at home. Those of us with chronic illnesses who frequent physical therapy, we have all the different colors of the bands and all, for the different tension. You know what I mean? So I'll work with that. He told me to work with the exercises and give it some time and come to a decision on my own. He's not pressuring me to have surgery, and I'm not running to have surgery anyway. I'm just really not interested in that. But then I go to physical or pain management, and the oncologist sent me there to address the necrosis that's in my legs, affecting my hips and knees. And she's like, I don't know why he sent you here for that. There's nothing that can be done about that. Okay. She's like, really? There's nothing that can be done. You really have to grin and bear it. And then when you can't do it, you can't bear it any longer, that's when it's time for a hip or a knee replacement. Isn't that crazy? But since I was there, I just asked her if I could be treated for the pain I have in my lower back, the constant, everyday, nonstop pain that I have in my lower back, and it also affects my sciatic nerves. Um, And she gave me two options, and I want to know if anyone had heard of this. She says because of insurance, I have to go through a radio frequency ablation first. And if I get any type of relief, we'll stick with that. But then the other option was spinal cord stimulator. And I really want to know if anyone has had either one of those procedures done. So that's the radio frequency ablation and the spinal cord stimulator. And that's actually a device. It's about this big, about, about as big as this box. And it gets implanted in you. And you charge it, like you stick a little battery pack to it, and you charge it every, I forget how many days. And the other one, which is a bit bigger, maybe that big, it lasts 10 years, but you don't have to recharge it. But in 10 years, it has to be removed and replaced. So I'm very interested in learning about either one of those procedures, if anyone has gone through them, whether it's been successful or not. So I have the paperwork to go ahead and have the radio frequency ablation. I'm going to call them tomorrow and set that up because that's a prerequisite for the spinal cord stimulator. So, any information you guys can share about that, I would really appreciate it. Also, if anyone has had multiple rotator cuff injuries and tears, how do you handle it with chronic illness, chronic pain? Is it a chronic condition? I know some people can, the rotator cuff can just be damaged, and I know that a couple of people who've just learned to live with it. And I just want to know what your opinions are, what your experiences are, if any, with the rotator cuff, as well as the other things I mentioned about the back ablation and the stimulator. So that was my day. I spent my day in doctor's office today. Well, I spent my morning in the doctor's office, not my whole day. But how's your health? How are you feeling? Have you had any tests or procedures lately? I'd like to know. Share with me in the comments. We're in this together. We're encouraging and supporting one another. I don't want this to feel like a one-way street because I know there's absolutely nothing special or unique about me and my chronic illnesses. I'm just sharing my experience and hoping to learn from others as well as encourage and inform others about things I pick up along the way. Anyway, I hope you enjoyed your Monday and made it a wonderful day. I hope you encourage someone today, especially yourself. It's Motivation Monday. Sometimes we have to be our own voice in the ear and encourage ourselves along the way. Sometimes we use our voices to encourage others. Whatever you did today, I hope it was great. Peace, love, and blessings. Luna out.